Giving birth is the most magical thing that we get to experience if we are fortunate or if we choose to do so. My name is Dr. Ipeleng, and today I'm talking about the most embarrassing things that can happen during labor, but they don't have to be embarrassing because I can tell you and I can assure you that nobody is judging you when you are in labor. Nobody is looking at whatever is happening. We are all concerned and worried about your well-being and the well-being of the baby. The first thing is defecation, and this is why. The muscles that you use during labor, the abdominal muscles and the pelvic floor muscles that you use to push the baby out, are the same muscles that you use when you do number two. And as the baby presses and pushes against your large intestines, you are more likely than not to do number two during labor. The second one is urination. So if your bladder has not been emptied, and most of the time your bladder is going to be emptied during labor or as you're pushing to help with the progression of labor. But if you do have urine in your bladder, as the baby pushes against your bladder, you may pee on yourself. The third thing that comes to my mind is passing gas. And this is the same mechanism with, doing number two. As the baby presses against your rectum, you may realize that you're passing a lot of gas and it might be quite loud. And yes, it happens and there's nothing to be embarrassed about. The fourth thing is loud noises and all different kinds of noises that you may make as you are in pain. You may start grunting, you may start yelling, you may start, producing all kinds of noises. And this is completely normal. It happens to a lot of women. And when you're feeling the pain, go ahead and scream, go ahead and yell. Nobody is judging you. When your water breaks, you could be in the mall, you could be anywhere. It doesn't warn you. And when that happens, it can be quite embarrassing. You are in the mall, you are in public transport, and your water just breaks. Nothing to be embarrassed about. As you give birth during labor, you may also start feeling like I need to vomit or start vomiting. This can be due to the medications that we give you during labor, or it can be due to, you pushing the exertion. As you push, you may start vomiting or feel like vomiting. Again, this is completely normal. We usually just give you something for you to vomit in, and you're well taken care of during this time. You may also start shivering, during labor or after giving birth. Most of the time, I have seen this after women give birth. You just start shivering and you are like, oh my God, what is happening to me? I am shaking out of control. The stress that you have just been going through during labor or that you're going through during labor, if the shivering happens during labor, and the hormonal changes will cause the shivering. Nothing to be embarrassed about. The other thing is, as your emotions are all over the place during labor, you may start yelling, you may start crying, you may start laughing, you may just start doing anything. And these emotions are caused by the hormones and they're also caused by the stress. That when you get to the hospital, when you are in labor, you have to take off everything sometimes and you're just given a small, shawl over yourself. And there will be tons of examinations, vaginal examinations, depending on how, the labor is progressing, whether or not you need to be examined a few times or numerous times. And you can find this quite embarrassing that, you are just, like that, naked. It can be embarrassing for some women. But again, there is not anything that we have not seen. And what we are concerned about is to make sure that you are well and that your baby is okay. We may need to do a little bit of episiotomy. What we mean by that is cutting just a bit to allow the head of the baby to come out. That we may do that, or it may happen on its own where you have a vaginal tear during delivery. That is sutured afterwards, so we don't let you go home just like that. But you may find that a little bit embarrassing, the entire process of you being cut or having the cut, the tear. You've probably heard about hemorrhoids, or what we also call piles. As you push during labor, you may develop hemorrhoids, or even during pregnancy. A lot of women during pregnancy end up developing hemorrhoids because of the pressure of the pregnancy, and also because of the constipation, which can be quite common during pregnancy because of all the hormonal changes. Hemorrhoids happen a lot, and after delivery, they usually go back. And if you need to be treated for hemorrhoids later on, after you have given birth, that again can be solved. In birth, you swell up a lot down there. You may find that to be embarrassing. It also does resolve after giving birth. In my situation, sometimes I do recommend that people put a bit of ice on that area, on the vulva, to reduce the swelling, or it can resolve on its own. You don't have to do that if you don't want to. There is a lot of bleeding during labor, depending on the pregnancy, or who you are at the time of delivery, or other conditions that you may have. There will be bleeding during labor. It can be excessive, or it can be normal amount of blood that we say, okay, you have bled and this is normal. And it happens, you bleed. And also the pushing of the placenta, you may find the whole process of, having to push again after giving birth a little bit uncomfortable or even embarrassing. But I do not think that a lot of women are embarrassed by the placenta. But just in case you find this embarrassing, this may be one of those things. The last thing that I am going to talk about is reactions to pain relief. Sometimes after getting epidural, you may feel some, sort of itching or shivering or feeling out of it. Not only epidural, there's also this, laughing gas internox that I have seen women just feel like, oh my God, I cannot believe I'm in this pain and I'm laughing, or I'm in this uncomfortable situation, I'm supposed to be crying, or this is something sad that just happened to me, and here I am laughing. So these reactions to pain medications are also completely normal.